registered physiotherapist. Today I'd like to talk to you about shoulder dislocations. So essentially you can think of the shoulder as a ball and socket joint. You've got essentially the head of your humerus, which inserts onto the inner portion of your shoulder blade. Now, what makes shoulder dislocation so common is that the depth of where the head of the humerus is and what it's supported by is essentially just muscular. So it's not very deep, and essentially all we have in terms of our ability to stabilize this area is just through our rotator cuff muscles, essentially. So really common in terms of seeing these different dislocations versus, for example, a hip joint. Very rare to see hip dislocation. There has to be some significant trauma when that occurs, and the reason for that is, again, the depth of how deep your femur is with regards to the hip joint. Now, there's three specific kinds of shoulder dislocations. There's an anterior, a posterior, and an inferior dislocation. So the anterior dislocation essentially occurs when the head of your humerus dislocates or comes out anteriorly, so in the front here. This is by far the most common type of shoulder dislocation. A lot of times this will come about as a result of actually being in this position here, which is referred to as abduction and external rotation, and either having a force hit the arm back in this position. It could be working out, for example, where somebody's doing a shoulder press and the weight essentially brings that arm back. A lot of times you'll see this in sport, where if it's a throwing sport, for example, and somebody's arm is actually hit back in this position, and again the head of your humerus will then go forward. The next type of shoulder dislocation is called an inferior shoulder dislocation, and so in this case what ends up happening is the head of your humerus again will come out of the joint, but it will go downwards or inferior. So a lot of times with this, it could be where, for example, somebody's been holding on to something and quickly bring the shoulder up. So for example, if somebody's not aware of how heavy something is and there's this quick force upwards, that again can bring the head of the humerus downwards. And then finally, the last one, it's called a posterior dislocation, and this is where the head of the humerus actually moves back. Now, a lot of times this will come about with some specific fall directly on the shoulder. So for example, if somebody slips on some ice and basically falls directly on the shoulder, where again the head of the humerus moves back, moves posteriorly. So typically with these three different dislocations, initially, depending on the severity of it, a patient will go to the hospital and have it basically have the shoulder put back into place. So there's sort of a traction technique that the doctor that's trained in this will do to again get the head of the humerus back into the proper position, and then x-ray. And then typically after that, the patient will be in a sling in this sort of closed pack position like this for several weeks in order to help tighten up all of the soft tissue within the shoulder and keep it neutral and keep it in sort of this closed pack safe position. Now, following being in the sling for again several weeks typically, after that the shoulder will get really stiff from being immobile like this. So that's again where the rehabilitation tends to come in. So after that period of time, the rehabilitation will consist of typically range of motion exercises, manual therapy in order to restore, again, full range of motion. And then a significant amount of the rehabilitation is with actually strengthening all of the different rotator cuff muscles that help to stabilize and support the shoulder joint. Again, as we talked about before, the rotator cuff muscles, that's really what gives the shoulder its stability. It's not the depth of where the head of the humerus kind of where it attaches onto the shoulder blade. And so again, strengthening is going to be really important, and eventually strengthening in these different vulnerable positions, particularly depending on what activity the patient wants to get back into. So for example, with an anterior dislocation, which again is the most common shoulder dislocation that we see, the patient is really going to want to avoid, over an extended period of time, this abducted and external rotation position, because again, this is the position of vulnerability for the patient. So having said that, at some point it's going to be really important in the rehab process to strengthen all of the different structures that'll help to support the shoulder in this anterior position. With an inferior dislocation, there's gonna want to be a period of time in which you're avoiding basically anything that's pulling the shoulder down. And with a posterior dislocation, again, avoidance of any sort of posterior pressure on the back of the shoulder. So thanks so much for watching this video, and please let me know if there's any comments or suggestions below, and I look forward to talking to you again soon. Take care.